Hi, I'm Dr. J. Varma, and welcome to Thermometer. On this channel, I check the temperature of health in the United States and around the world and give you expert insights on infectious diseases and public health. This is our weekly episode of Inside Outbreaks. And on these episodes, I review the latest outbreaks of infectious diseases, outbreaks that you need to know about. And I do this with my friend and colleague, Jon Epstein, a veterinarian, virologist, and disease ecologist who, like me, has spent his career tracking dangerous infectious diseases across all corners of the earth. Thanks, Jon, for joining me today.
Hi, Jay. Happy belated 4th of July.
Yeah. Did you have a good long weekend at all?
I had a really nice weekend. It was fairly low key, but had some family in town and just hung out. How about you?
It was good. It was good. I went up to Massachusetts and went to this kind of retreat center and got an opportunity to swim a couple of times in a lake that they have near the retreat center. And that actually got me thinking about the topic that we have this week, because there's also some unfortunate news this week about kind of the hazards of water systems, something that we like to enjoy, obviously, for our health, but also for recreation, right? And there are these incredible events and sad events going on in Texas right now.
Yeah, I guess it ties in. We should start by saying we're really talking about contamination of water. So the bigger issue now is that over 4th of July weekend in the New York area for sure, and in other states around the country, there were beach closings because of excessive contamination of coliform bacteria, right? Or bacteria that can cause GI system disease.
Yeah. And so, what was kind of linked together and brought us to discuss this topic today was, as people are almost certainly aware of here in the United States, there was a massive flash flooding in Texas that resulted in, I think at the moment, there's over 90 people have died related to this, many of them who are participating in a camp there. It's a really unfortunate and sad story. And then I was also struck in the news, as Jon, as you just mentioned, about a number of recreational beach areas around the country, pretty much every region of the country. There were places in the Northeast, places in the Midwest, places in the South, all the way in the West Coast, up and down California and Oregon, that had to close beaches, and not just the beaches on oceans, not just, the sandy beaches of California or like the Hamptons here in the New York area, but rivers and lakes. And all of these things, unfortunately, connect together. When there is this sort of overrunning of water, there is the danger that our water can get contaminated. And when it gets contaminated with is bacteria, particularly, bacteria that we flush through our systems when we go to the bathroom, and they can end up in our water systems and then result in us not being able to swim in them for fear of getting sick, and also not being able to drink them if they become a water source for us.
That's right. It's something that happens globally whenever there's, monsoonal rains in some parts of the world that results in flooding. That can start to mix sewage with water that's, in wells or drinking, and that can cause an increase in E. coli infection or salmonella infection. So that people, have to really be careful post flooding to make sure that they have potable water. And so here in the United States, we've just had horrific flash flooding down in Texas. And the immediate news is really about the people who are lost in the floods and the trauma of, having people killed by the flash flood itself. But in the aftermath of that, we'll also have to look at contaminated drinking water and water sources to make sure that there isn't a follow-up outbreak of enteric disease.
Yeah, I mean, here in the United States, we take for granted a lot of infrastructure that is missing in many parts of the world that you and I have worked in, where, you open up your tap and clean water comes out of it. And when you flush your feces and urine down into the toilet, it goes into some type of system that works to decontaminate the water, and then return it back into nature somewhere. Or if it doesn't get decontaminated directly, it ends up in some type of septic system or some type of waste station that prevents it from getting back into the drinking water. But when you have these massive floods and the whole water systems, the plumbing systems, the drainage systems basically get flooded and overwhelmed, those septic systems fail. They essentially can't keep up with all the water that's seeping into it. And you get dangerous water quality problems. And this is becoming an increasing problem here in the United States. And it relates to a lot of the political issues that we've discussed before. Is I think people have taken for granted a lot of the infrastructure that was built really kind of in the post-war system in the United States, the infrastructure building of pipes and systems. And so I think we're hearing more and more about this, because not just do we have problems of climate change and rain, but we also have an infrastructure that can't necessarily keep up, right?
Right, right. And, independently of the drinking water system or situation, the issue with beaches. So when there are reports locally, and thank God we have local public health departments who are testing water for levels of bacteria that could be hazardous. But when there are reports about hazardous bacteria levels and there's a warning issue about swimming, it's important to understand what the risks truly are. I mean, what you're really worried about is if you're in water that has high levels of bacterial count that can make you sick, is if you get that water splashed into your mouth, you accidentally swallow some of it, maybe you have cuts or abrasions on your body that could allow some kind of infection there, the risk is simply much higher. And so it's really to protect people from getting, GI and diarrheal disease from being in water with exceedingly high E. coli levels.
Yes, exactly. And in, in other parts of the world, you get outbreaks of cholera and typhoid fever from this. And
Mhm.
the reason you get them in other parts of the world, but not the United States, is that most, or if not everybody in the United States, doesn't have those infections, right? So they're not releasing it out of in their intestinal system, and it's not getting into our wastewater systems as well. I want to touch on something that you mentioned, which is, the work of public health agencies. The monitoring of water quality is something that's actually quite variable across the United States.
Mm.
There are environmental health agencies and there are public health, like human health agencies. And the jurisdiction varies depending on what part of the country, what county that you're in. But essentially, these government workers are responsible for doing the pretty much very basic stuff, simply going to recreational or drinking water sources, taking small samples of the water, bringing them back to a laboratory that's usually a government operated laboratory to test them. Essentially take those water samples and grow them on a plate or run them through a PCR test to look exactly for those bacteria that you mentioned. And those bacteria are what we consider indicator bacteria, right? There could be a whole range of other dangerous bugs that are in there, but we look at those because those are so abundant in the human intestinal
Right,
system
right.
and in our feces that they kind of are like, if you have that in there, there must be other bad stuff in there as well. And so this is just another call for all of us to be aware of this hidden infrastructure that exists out there that keeps us all safe. Needs to actually be funded. And it's a really important thing that we get. It's actually a good sign that we're getting these warnings in a way. It's not good that the water is contaminated, but it's good in the sense that it means there are public health agencies out there watching out for our health.
Yes. Yes, absolutely. And as we are in the throes of summer and we're seeing hotter and hotter temperatures, there's going to be more inclination to go swimming and to, get into some of these public water sources, lakes and rivers and streams. And so it's really important to pay attention and have an understanding of what the risks might be in terms of, exposure to bacteria. And we hope that most of our water is clean, of course, and most beaches and swimming areas are safe most of the time. But as you say, these surveillance systems are so important for letting us know when there is particularly high risk.
Yeah, and we've been talking for the past few minutes mostly about like human waste, but John, animal waste is a problem as well too, right? Particularly in these freshwater sources like rivers and lakes.
Sure. I mean, the same is true if there's ever a freshwater system near a large farm or agricultural installation where effluent from that farm could potentially contaminate fresh water. And most industrial farms try really hard to have sewage treatment or runoff treatment so that they're not contaminating freshwater sources. But, inevitably, occasionally it can happen. And particularly if there's flooding involved and heavy rains, that can wash agricultural waste and runoff down into freshwater systems. So you might have a spike in contamination following heavy rains.
Yeah, so let's just give a little bit of advice then for the viewers out there. I mean, you just highlighted an important one, which is avoid swimming in areas near livestock, unless you can be really assured that those water systems are safe. Stay away from water sources, after there's been a big heavy rain for 1 to 2 days, because that heavy rain can lead to that overflowing sewage. Watch out particularly for cloudy water, right? People don't carry around with them some detector for
No.
fecal bacteria. But if it's cloudy, that can be a sign that there may be germs or that, there's pipes that are draining water into there that shouldn't be. And think about when you leave that water, if you've gone swimming in a lake, as soon as you get out of there, you're probably tempted to grab a snack or something. Wash your hands first, because you can't really be guaranteed that lake water, even though it's very refreshing on the outside skin,
Mhm.
is actually clean.
Absolutely. And it's hard to tell that sometimes we think of if water is severely contaminated, we might see, dead fish or animals that are indicated, but it's not always clearly apparent. If there's severe algal blooms, if we see big algal blooms, sometimes you see wildlife affected by that, particularly fish and freshwater systems. With bacterial counts, it's not always so apparent. So I think it also, stands to reason to avoid, fishing at times when there might be high risk for high bacterial counts, because fish that you eat from those freshwater systems may also have high bacterial counts too.
Yeah, and we can't, I think, leave a discussion about humans interacting with water and animals interacting with water and in nature without also talking about climate change. And so, Jon, what do you think about the future of our recreational water sources with climate change? What are the things we need to be watching out for or worried about?
Well, a couple of things. I mean, we do see a correlation with sometimes increased algal blooms, increased bacterial counts with increased temperature. So as those water systems get warmer, it might promote growth of some of the bugs that could make us sick. Also, with hotter temperature, we're going to be, again, more inclined to go jump in a lake and get cooled off in the water. And so we just have to be aware of, as you say, making sure we're washing hands and cleaning ourselves off after coming out of those sources, and paying attention to local reports from public health services that might let us know if there are particular hazards. We know from oceanic waters, as sea surface temperatures rise due to climate change, we tend to see increased outbreaks of cholera. We see algal blooms, which means there might be more biotoxins that are getting into shellfish and seafood, kind of red tide scenarios. And so there are all kinds of things we have to watch out for as temperatures rise that could impact our health with respect to water systems.
Yeah, absolutely. And so, we're going to keep everybody up to date on this type of news as it goes around. But I think it's just always such an important reminder for us that, climate change is really one of the biggest health risks that we face, and it's going to impact our fun and recreation as well. And now I wanted to switch to a slightly different topic, but one that kind of I got triggered about when I saw a news report this morning that reminded me of an outbreak that occurred a few weeks ago that we had been planning on discussing, but it kind of got bumped off our schedule. So I saw a report this morning, and I think you may monitor the same source. There's some really great infectious disease warning systems that people have put up where they kind of scan the literature around the world. And they were talking about a woman in Hong Kong who, came into a hospital with signs of paralysis. She was having weakness in her shoulders and her neck. She was having difficulty swallowing, difficulty breathing. And it turns out that, she went to a cosmetic facility in mainland China, just across the water from Hong Kong, and probably got injected with what she thought was going to be Botox to get rid of the wrinkles on her face, but in fact was somehow contaminated in some way, or they gave her an excessive amount of it.
Mm-hmm.
And it reminded me of an outbreak that occurred earlier in June, where there was quite a lot of publicity in the Northeast about that the Massachusetts Department of Health was warning the public about a cluster, not just one case, but multiple cases of botulism poisoning, essentially from getting Botox injections. The Massachusetts Department of Health reported 10 different people who had signs of weakness and facial paralysis, all associated with getting injections at a spa called the Rodrigo Beauty Spa in Milton, Massachusetts. So, Jon,
Yep.
how many times a week do you get Botox?
I was going to say, how am I looking? Because I haven't had one recently, but I think it might be time. I have turned 50 recently. And so, but now I'm going to be, a little hesitant hearing about what the things that could go wrong with Botox injections. But Jay, isn't the point of it to actually induce paralysis kind of locally in your face? Isn't that how it works? And so these are what? These are instances where an excessive amount of toxin has been injected, or maybe a contaminated batch that's causing more systemic paralysis, right?
Yeah. So, botulism is just a fascinating disease. It was actually one of the first diseases that I worked on when I joined CDC back in 2001. I was what's called an EIS, or Epidemic Intelligence Service Officer at CDC, in a group that was then called Foodborne and Diarrheal Diseases. And we had the sort of, I guess, called a unique privilege, maybe the burden of carrying something called the bot pager. And it was kind of like the bat phone. It has that kind of link to it, but it was a pager that you had to carry, and you went on duty, I think, for about a week at a time, and you rotated with the 4 or 5 other people that were also training in my group. And if that pager went off, you were responsible for, contacting a hospital or a physician that was calling CDC, because CDC was the only repository other than the state of California at the time for the antitoxin used for botulism. And so what is this? So Botulism is a toxin that is produced by a bacteria called Clostridium botulinum, and it grows in very specific situations. We often think of things like canned food,
Right.
where the cans have been dented and the pH and the sugar content and the lack of air in there is just enough to allow this toxin, this bacteria in its spore form, to release a toxin. And what's unique and dangerous about this toxin, it is one of the most, if not the most potent biological toxin known to man. So this chemical that's released by the spores of this bacteria can poison people. And that's why it's so good at introducing paralysis in a small nerve and getting rid of your wrinkles. But if you take it in higher doses, it's going to paralyze your entire body, lead you no longer to be able to breathe because your diaphragm isn't moving and you can't breathe in air. And then you might die from it.
Yeah, no, it's pretty serious stuff. And I suppose for the most part, the beauty sector that does, Botox administration, is regulated, and there's, standards for that. But you have to be careful because occasionally there might be, spas or places that are injecting Botox that may not be licensed, or maybe, it's a contaminated batch that they might not even know about. And I don't know, Jay, how would you know? How would you know exactly what the risks are? Or is this just an inherent risk in getting Botox treatment that
this is a great question. So, how does this happen is the first question. And
Yeah.
the answer almost inevitably is that people who are not fully properly trained, or more often than not, following quality control procedures, may give too much of the drug. The drug that they may be getting might not be dosed or loaded correctly, right? So even if they think they're giving the right amount, they're not actually, because the dosage isn't correct. Or the third is maybe they're injecting it too deeply, or in a location that they shouldn't be. And the challenge, of course, is, again, this gets to this topic that we keep hitting on about why government's important is, these facilities are supposed to be regulated. In almost every state, the person doing the injections isn't necessarily a full medical professional. They're often an esthetician, right? They have some type of cosmetics training, and they're supposed to be supervised by a licensed medical professional, often maybe a nurse practitioner or somebody who's a chief medical officer, but often not on site. And it requires these to be, supervised in a very controlled manner. But often they're not, right? Often people are getting this done at essentially what's the equivalent of a beauty salon.
Right.
And it's a big moneymaker, right? I mean, lots and lots of people I hear of stories of, my kids tell me, or kids in their 20s, they tell me about kids that they know in their 20s and early 30s who are getting this done because they're so afraid of it. And as you can imagine, they're not going to have the money to necessarily go to a licensed physician to administer this. So they're likely to go to one of these aesthetic facilities where the people aren't necessarily fully trained. The proper procedures aren't necessarily being followed, and that can put you at risk.
Yeah, so it's a good reminder to be an informed consumer when you're doing any kind of medical procedure, and Botox would be included. But Jay, it really makes me think. I think I'm going to embrace my wrinkles and hold off on the Botox treatment for now, just because I'm not looking forward to any kind of extensive paralysis from this.
Well, it's definitely a break from regular life if you end up with paralysis. But yeah, I mean, to be fair, to be very serious to people out there, I think it's really an important reminder that any type of procedure you get where you are getting an injection, whether it's botulinum toxin, Botox, whether it's a filler, make sure you're getting it from a facility that is properly licensed and has undergone proper training. And there are ways for you to, ask the facility to use the internet searches to verify credentials, look for accreditations, ask the estheticians who's actually overseeing it, what medical professional is overseeing this, because, even though the price might be, the one you want to pay because it's really low, you also want to be as safe as possible. And so this is where things like licensing and regulation of medical spas, is really an important thing, because we don't want people to suffer the extreme consequences of when really all they're trying to do is, make themselves look a little bit more attractive in their daily life.
Yeah. And, Jay, I want to give a shout out, because we brought it up, to our friends at Beacon. up in Boston. This is an AI-driven global infectious disease surveillance network that basically scans outbreak news and aggregates information about infectious disease. This is a newly launched system that's hosted by Boston University and the Center for Emerging Infectious Diseases. And it's just a great thing and a real useful tool for those who want to track and pay attention to epidemics around the world.
Yeah, there are a number of great resources that have been developed over the past a few years. There were a few that were operating before, COVID struck. And then, of course, COVID has created sort of an outbreak of disease monitoring systems. But the reality is we need as many as we can get. Essentially, these systems rely on scanning any type of potential information source that's out there, what we call open sources. So it could be government press reports, it could be social media reports, it could be media reports in every different language. And Beacon, the one that you mentioned from PU, is the one that I think you and I both flagged and saw this morning.
Yes.
Got a list describing this, botulism case in Hong Kong. And yeah, these are really an incredibly important resource. So if you are somebody out there that's weird like John and me, that likes to know about risks that are out there, that likes to know about diseases occurring in humans and animals and around the world, definitely look into Beacon, look into Health Map. The University of Minnesota has an entity called SIDRAP. There are a number of great resources out there where you can get lots and lots of useful information about disease risks around the world.
Yeah, we should throw some links into the comment section under this episode. We'll make sure that information gets out there. These are good resources.
Yep, absolutely. Well, thank you very much, John, for joining this week. I'm going to assume next week that you will not be swimming in any dirty lakes, and
I hope not.
And that we'll see you next week, and both me and you, wrinkles and all, for another opportunity to discuss the latest outbreaks in infectious diseases. So if you like what you're seeing, please hit the like button, please hit subscribe, please share this episode with people in your life, and we'll see you next week.
Thanks, Jay. Have a good week.